All right, good morning. How's everybody? Ready for Thanksgiving next week? Yeah. Right, it's coming so soon, right? Yeah, it's next week. It's next week. So as a college, we have school next week, which is really unfortunate. I'm sorry. Like I feel your pain, right? I decided to not have class next week. It's been on the syllabus from day one. I can't control. Oh, you're welcome, right? I will be eating. I hope you're doing the same, right? So I can't control your other classes. I hope some of your other instructors are doing it too. But it is like the lowest attended week of the year. Everybody goes places and travels and needs a break. And so as far as our class is concerned, you get a break. I hope some of your other classes do that too. But we'll have class like normal this week, Monday and Wednesday. And then next week I won't see you for Thanksgiving. We'll all get fatter and enjoy our food and all of that. And then I'll see you after. Hopefully not too much, a little bit, right? A little bit of extra food. So what I want to do today is we're going to wrap up personality disorders, and I'm going to do so kind of quickly because chapter 14, I always show a film for chapter 14, and it'll take us almost all of today and next class. But it's amazing practice for your final paper, which is due in a couple of weeks. Okay, so we'll talk more about the final paper probably right after we come back. But it will be a really good practice for that because you'll be looking at symptoms and causes and treatment and formulating the diagnosis. So we'll get there in a few minutes, but I want to wrap this up first. Just a little bit about causes and treatments, and then we'll get to chapter 14 after that. But we went through all of the different disorders, all 10 of them, right? I hope you enjoyed the little personality party. I always think that's fun. But in terms of causes and treatments, we often talk about them together because there's so much overlap with these. And it's thought to be like a multidimensional risk perspective. But beyond that, it's something that we call like a psychodevelopmental perspective, right? In the sense that it's thought that like everything builds on each other and creates almost like the perfect storm of factors that can cause a personality disorder to come to the surface. And in theory, I should rearrange these. It's thought that somebody like is born with a biological genetic vulnerability to getting a personality disorder. There's something genetic, there's something kind of neurotransmitter deficiency, there's a biological genetic piece. And then because you're born with that in place, it kind of shapes a little bit about the way that your parents might raise you and the world in which you grow up in, right? So there's also these like psychodynamic where early childhood and parent interactions start to set the stage. And then you have your behavioral stuff, modeling and conditioning, the events that happen to you in your life. Like we talked about, like with borderline personality disorder, that maybe somebody leaves you, right? There's some kind of abandonment when you're young. Or antisocial personality disorder, maybe there's a violent like family environment where something happens when you're younger, right? So there's this behavioral piece, which then shapes the way that you view yourself and other people view you. And then it might create some like interesting societal stuff that's going on with the way other people label you. And in general, what we're just saying is it's a combination of everything. It's almost like the perfect storm in the wrong way, right? That happens to create these. So again, it's like a biological vulnerability that then shapes the way your parents interact with you and view you, shapes the way you view yourself, the modeling and events and everything that happens to you. And it all interacts with each other in that way. Now, certain disorders have a little bit more specific vulnerabilities, like I mentioned with borderline personality disorder, for example. But this is the main thought. It's a multidimensional, like psychodevelopmental risk perspective where everything builds on what came before to create that perfect storm. And as I mentioned to you last time and the time before, these are super controversial disorders because, again, you're saying that somebody's personality is the disorder. And it's so hard to change your personality. Your personality is enduring. It's everything about you. If somebody asked you to change, that's not the easiest thing to do. And so treatment for these is notoriously difficult. People with these disorders, individuals who have personality disorders, don't always go to therapy, right? It might just be something that you mistake for like your personality, or some of the specific disorders, are going to shape like that willingness to go or not go. So there's a lot of issues with this, right? I thought that might make it a little easier to see. What happens is if people do go to therapy, right, it's typically because they're struggling in areas of their life. Like I'm having a hard time with relationships. I can't keep a job, right? I'm losing friendships, right? Or I feel really lonely and isolated. And that might drive somebody to therapy. And typically what we do in therapy is we try and help with like teaching specific skills. So if somebody has a lack of empathy, let's focus on empathetic like awareness and skills. If somebody is really paranoid, let's challenge those paranoid beliefs and try and teach you a better way. If you tend to be isolated and withdrawn, let's focus on that. If you tend to be dependent, then let's try and get you to make your own decisions. So it's a lot of teaching social skills, challenging thinking patterns, and so on. But there are a lot of obstacles here. The histrionic personality disorder individual is going to try and seduce their therapist, right? They're going to be wildly dramatic and emotional and try and seduce them. The antisocial personality disorder might harm their therapist. I'm thinking of like, what's the Patient, right? The show that's, that show The Patient, if any of you've seen it, somebody who's a murderer and a killer, right? Kidnapping their therapist and keeping them in the basement or something like that. The person who has narcissistic personality disorder is going to think they know more than the therapist. Like, why would I listen to you? I know more than you, right? The dependent personality disorder is going to cling to them, do everything that they say, right? Each of those disorders have barriers to therapy. So therapy is helpful, but it's usually that we teach specific skills, right? And that's kind of the focus. You can't necessarily get rid of them. You can teach somebody to fill in the gaps and live with them. Right, and to live with them pretty successfully, right? A lot of people do learn to balance it out. Sometimes we might give medication if we believe that that would be helpful. Like if somebody's anxiety levels are so high that they need help with that, we'd give them an anti-anxiety medication, or their depression levels are so high, right? So we might consider medications, but it's mostly social skills training, trying to fill in those gaps, challenge perceptions, and those are the things that we tend to focus on the most. So treatment is not easy because it's very difficult to change your personality, but we can try and help you with the areas that you're struggling to make life a little smoother. I mentioned this again, these are very misdiagnosed. There's a lot of issues with these. It would not surprise me if in the next DSM, like the DSM-6, whenever that comes out, if these are completely reworked or one day eliminated. Right. These are very misdiagnosed. Two people with the same disorder can look wildly different, right? Especially in this cluster. There's a lot of similarity within groups, like within the dramatic group, the anxious group, and so on. And people with very different personalities can get the same diagnosis. So there are some other places, like in Europe, we use something called the ICD, the International Classification of Diseases. So that bulb is starting to die, and so everything is like fainter than normal. In Europe, they use the ICD, International Classification of Diseases, and it operates this area on the Big Five. If you've ever heard of the Big Five personality traits, what they do is they view it in a very different way. And so that's kind of one future area for improvement or growth or change. But these are very controversial. There's a lot of problems. And so it wouldn't, as I said, surprise me if in the future they're reworked a little bit. Yeah.
You'd be interested in with that comment you made a moment ago. How often do they revise the DSM? So it is not done like clockwork every 6 years,
No.
every 10 years.
No.
And so how is it decided that a new one is needed? Just papers are published where there's a breakthrough in the field where they realize revision is needed. So so they're up to number 6 now, then you're saying?
We're on the 5th text revision. So just this year, the text revision, so a small revised copy of the 5th one was done. Very minor like changes, mostly in wording. But the DSM-5, which was done in 2012 or 13, was a huge change from the DSM-4 text revision. So it wouldn't surprise me if it's probably going to be a few more years before we have 6. So it's just a matter, there's a committee that makes these decisions. And so when they feel like there are enough revisions that need to be made based on research, based on culture, at that point, they would revise it. But it takes years.
How many years between 4 and 5?
Oh, geez. Between the text revision, of 4, and the 5th one, I want to say there was about 8 years in between those two.
When 4 was first cited.
Yeah.
They need to make, well, 3 to 4, what year was 4 published in? Because mine, you said 2012.
Yeah, I don't remember the year that 4 came out. The text revision for the 5 was about 8 years, but forgetting the year that 4 came out. If anyone finds it out, let me know. Just look at what year was the DSM-4 put out there, or I can look it up too while we're watching the film.
Sorry.
No, it's interesting, but it changes constantly. There's a committee that's meeting now, right? It's just not till they have enough changes and enough agreement, which is a process. Do they actually then go ahead and like publish a revision? Yeah.
This says that the DSM-4 was published in 1994.
Thank you. So 1994. So 1994 to 2000, what, 12, 13. So what, 18 years? I'm not a math person, like 18 years ish, right? Yeah. But thank you for checking. My kids have passed my math ability. My 5th grader, I'm like, I cannot do her math. It's ridiculous. Like, she asked for help with her math. And I'm like, let's wait for your mom to come home. I'm like, I can't do it anymore. It's too hard for me. I don't know how to prime factor a number. I just don't. Common Core math is the worst for me. Anyway, I didn't grow up doing Common Core math. All right. And as I mentioned earlier, I'm kind of going a little quicker so that we can start that film. But chapter 14, which I posted the slides, they're up for you. We're going to be spending some time watching a film, and it's an older movie, but it's such a good example for this chapter called What's Eating Gilbert Grape. I'm sure some of you have seen it. If you haven't, that's amazing. And if you have, you're going to watch it through slightly different lens today. But you're going to be focusing on the character Arnie. And Arnie is played by young Leonardo DiCaprio. And he did a very good job in this role. And so what you're going to be doing as we go through this film, is you're going to be making a list on number 2. Okay, so I want you to just do bulleted list for number 2. You should have lots of things that are there. Anytime you see a deficit in Arnie's thinking or behaving, put it down on number 2. So that should be like a running thing that you focus on today. I'm not going to collect this on Wednesday. I'm going to collect it after break, after Thanksgiving, so that we have some time to talk about it. So if you don't quite finish, that's okay. But please work on this during the meeting. It should not be homework for you. Okay, especially when we get on Wednesday, you can start to get some ideas for causes and treatments and so on. Okay. And Johnny, that's so yeah. Does everyone have one? Okay. Okay. So what we will do for the rest of our classes is, again, be working on this worksheet. You're welcome to work on this during the movie. In fact, please do. I'm going to post the link to the movie on Canvas while we're watching this. So if for some reason you missed Wednesday, you can finish the movie for free without having to like go rent it or online. But what I want you to really focus on today is number 2. And then when we get to Wednesday, you can start thinking about number 3 and 4. What disorder do you think he has? What are some causes? And then number 5, what are some treatments? This is what you should be doing in your paper. So my goal with this is, 1, to have you think about Arnie in a very critical way and summarize what you've learned and what we're covering. But 2 is to help scaffold you up to that paper, right? Which is due in a few weeks. So I really want you to be focusing on the symptoms. And then on Wednesday, you can look at causes and treatments a little bit more. Okay. So I'll turn off the light. Please stay with me. Don't fall asleep. Right. But we'll go all the way up until the end of our class time, and then we'll pick up where we left off next class. Okay. And I put the captions on, so hopefully that'll make it easy to hear. All right. Here we go. Oops, sorry.
Soon. But want them to come. No. I wanna see them. They're coming soon, huh? How many miles till they come, Gilbert? 3 million. 3? Yeah. Okay.
This is Arnie. Not him, but Leonardo DiCaprio.
Turn 18. My family's planning a big party for watching the campuses are yearly ritual. They're doing the right thing, just passing through.
So big for so be able to carry on. No. Breaking. Breaking.